about a third to half of patients are not eligible to receive cisplatin-based chemotherapy. And thus, these patients go on directly to radical cystectomy and aren't afforded the chance of receiving neoadjuvant chemotherapy. We know that neoadjuvant chemotherapy in platinum-eligible patients prolongs survival. So the purpose of this trial was to determine the response rate and toxicities of giving Enfortumab Vedotin in the neoadjuvant setting in those patients who are not eligible to receive cisplatin chemotherapy. And we overall treated 22 patients in the study. The trial demonstrated that about a third of patients, 36% of patients, had a complete response to EV, and about 50% of patients had pathological downstaging. That includes those patients who went to T0, T1, and TCIS. We did see toxicities within the trial. About a third of patients had neuropathies, but no patients had grade 3 or higher. And we also saw skin rash in 2/3 of patients. Again, no patients had grade 3 or higher. The dosage of Enfortumab that was administered was a little bit lower than what's approved by the FDA for those patients who are progressed after platinum or checkpoint therapy. So we gave a day 1, day 8 schedule of 1.25 milligrams per kilogram rather than a day 1, day 8, 15 schedule. So this looks very promising. There are trials ongoing at this particular point that are combining Enfortumab with checkpoint therapy, and these will hopefully help to define the role of Enfortumab in neoadjuvant treatment. The next steps are a randomized trial against standard of care. So in the platinum eligible will be against GemCis or MVAC, and then in those patients who are not eligible, directly cystectomy, because really there is no standard for those patients.